So first I want to ask you just about the distribution here in the state. How many doses are we getting weekly as of right now? I know it's been going up, so that's promising.
Yeah, right now we're getting 22,500 doses a week for the state. Now, the pharmacies, CVS and Walgreens, they're getting more. And so we have more than that coming in. I am optimistic that we're going to get more by the end of the month. I mean, I read the same newspapers everybody else reads. And, if the federal government said they have 240 million doses distributed by the end of March, that's a lot more vaccine than we've had. So we haven't heard yet that we're getting a lot more vaccine, but I'm pressing our people to kind of find out, are we really going to see a big surge in vaccine in the end of March? I will say if we get a big surge of vaccine, we're ready for it. In other words, we can distribute a lot more vaccine per day. So if there is a big surge of vaccine, we'll be ready to get it in people's arms as soon as possible.
Okay, and I want to ask you too about, we're hearing a lot about second doses being held. How much of, what's being held in the state is second, how many second doses, I guess, are being held right now or in that reserve? And what do you think about them still being held? We're hearing people say they should be pushed out a little quicker now that we're down the road a little bit.
Yeah, obviously we want to get as many people vaccinated as quickly as possible. There aren't a lot of second doses being held for people, though. In other words, there's not this big warehouse of vaccine just waiting to go. Having said that, the Moderna and Pfizer vaccine are 2-dose vaccines. We do have to give people their second doses to make sure they're effective. One of the things you hear in some other countries about giving just 1 dose of those and then delaying the second dose, that idea hasn't gotten a lot of traction in Rhode Island. And right now, while the prevalence is decreasing, it's probably not the preferred public health approach. So really the preferred public health approach right now is give everybody their second dose as close to on time as we can. And that's where we plan to be. But there is no big warehouse of second doses just waiting for people. And one of the things I would remind people is when you make your appointment for your first dose, just go ahead and make that appointment for the second dose so you have it, organized in your life so you don't have to worry about getting that set up again. That's just easier for you. It's easier for the vaccine planners, and it's easier for the vaccine administrators.
Let's talk about timeline, because I know that on Friday we got big news about the Johnson & Johnson vaccine. I spoke with Joseph last week about it a little bit, and he did say that even though we saw that approval, on Friday, it's going to take a few weeks in order for us to see it here, for people here to start getting that vaccine. Can you kind of explain that a little bit?
Yeah, so we ordered 9,100 doses on Sunday night. So I expect those vaccines to be in Rhode Island either today or tomorrow, and then to be given soon after. And so meetings have been held today about where they're going to be distributed and how they're going to be given as soon as possible. Obviously, we want those vaccines in arms right away. Certainly before the weekend, we want those vaccines in arms. I think that's achievable. That'd be my preference. And I think, that's a single dose vaccine. That's a one and done. I think it's going to be a popular vaccine among people because I think people are liking that idea of like, look, this is a good vaccine. I only have to get one visit out of the way. So I think it's going to be popular. I think demand for it's going to be pretty high.
And how many did you say you ordered of those?
We have 9,100 doses coming. And I expect by the end of the month, we'll have 35,000 doses of Johnson & Johnson vaccine is what we're hearing we're going to be getting. So it's a nice shot in the arm to our program, pun intended, by the way.
Always pun intended. I want to ask you, because you say too, you think it's going to be popular amongst people. What does that say about, are we encouraging people to pick their type of vaccine? We're hearing so much about this vaccine shopping, people being able to choose what type of vaccine they get. We're seeing discouragement against that. What are your thoughts on that? And is the state, I know when you go on to the Rhode Island Vaccinate RI website, you can see what you're getting at the Dunk, at Sakanasset. Do you think that that's encouraging people to go kind of vaccine shopping? And do you encourage that or discourage that?
So we're telling you what vaccines available so we can be transparent. I don't want anybody to be surprised. I don't discourage people to delay vaccination based on which one's out there. Quite frankly, there's 3 really good vaccines. They were studied at different times in different places. You can't compare. They're like apples and oranges. So quite frankly, the best vaccine for you is the next one that's available. So this is one of those times where just get the next dose. You're doing yourself a favor because you're getting the vaccine. For you, that starts to protect you. You're doing the rest of the state a favor because the more people we get protected as quickly as possible, the better off all of us are together. And if there's one thing this pandemic's been about, I think everybody should have figured this out by now, is the pandemic's about all of us working together. One of the things I think about more and more after a year of this pandemic is I'm so reminded we desperately need each other. and we have to have each other's backs on this stuff. So it's like, get your vaccine, get it as soon as possible, and don't be picky, please. Just go ahead and get it, please.
So did you say, I'm sorry, I may have misheard or it may have broken up. You said you discourage delaying getting a vaccine?
Yeah, strongly discourage delaying a vaccine just to get the dose of your preference. It's not a good idea. It's not helpful for you, and it's not helpful for the state, because we have three really good vaccines. Since we have three really good vaccines, just quite frankly, get the next available one.
How do they differ, those three? Can you talk about that? We know that Moderna and Pfizer are very, very similar. They're both 2 doses. How does Johnson & Johnson differ from that?
Yeah, so one thing is it's really about delivery system when you think about it. They're both, all three of them are shots, but what's different is in the Pfizer and Moderna vaccine, they use a messenger RNA through a lipid molecule. But with the Johnson & Johnson vaccine, it uses a genetically modified adenovirus strain to deliver it. But they all do the same thing in the end, which is tell your cells in your arm to make the spike protein. And when you make the spike protein on those cells in your arm, your own body's immune system will respond to that and create an immune response all over for your body. And that'll be great. And that gives your immune system for your entire body the knowledge now in your computer hard drive of your immune system, how to protect yourself. So if you do get exposed, your immune system is Johnny on the spot right away and gets rid of that, any potential infection right away. And that's why in some ways it's the delivery systems that's a little different, but quite frankly, the immune response is the same and they're all very effective.
When we start to see that Johnson & Johnson vaccine come in, how does the state, distinguish who gets that? Where does that specifically go? Because like you said, it is that 1 dose, so it's going to be different for some people. Are certain people on a higher priority for that when it does get here?
Yeah, we're not changing our prioritization of the Johnson & Johnson vaccine because it's really got the same emergency use authorization as the other two. And so it's just as good for anyone, whether they're 65 or older. That's our population right now. But when we open up in the next week or two to people with underlying conditions and 60 to 64, it'll be just as good for them as well. So we really do want to see people, just go ahead and get it. But that's where I get back to, I wouldn't say, oh, I've got this condition, therefore I want this vaccine. It's just not helpful for you. It doesn't work any better that way. So I just go ahead and get the next available dose.
So those 9,100 doses of the Johnson & Johnson that will come in, those will be distributed randomly. Some, your neighbor could get it. Is it just kind of random in that sense?
So we're still deciding which sites are going to get it. It's really going to be about who can deploy it the quickest, because really that's what it's about. It's about rapid deployment of a high quality vaccine and getting it into people's arms as soon as possible.
And does that one, storage on that one, is that different from?
What's nice about the Johnson & Johnson vaccine, you store it like every other vaccine, which is in a refrigerator and the same temperature. So the storage is much easier, comes in a 5-dose vial, very simple and very typical dose that we do with other vaccines. So it'll look a lot just like other vaccines we've had. So in that way, the logistics are a little bit simpler.
Do you think that implementing this new vaccine will speed up the state's timeline and we'll see newer or, more of the age groups kind of pushed up a little bit?
I hope so. My hope and prayer is that we get to our underlying condition population in the next week or two. Quite frankly, some people with the underlying conditions are worried they're getting forgotten. And I promise you, the Department of Health does not forget about you at all. We know that people who have underlying conditions, whether it's kidney disease, diabetes, people who have cardiovascular disease, or other problems with their lungs, we really care about these people, especially those with immune systems that aren't working, those people have cancer. We really want to get those folks vaccinated as soon as possible. That high-risk group, we really need to get them vaccinated as soon as we can, because we really want to keep people out of the hospital and save as many lives as possible. That high-risk group, they're the group I worry about next. I want to get them going as soon as possible. There's a lot of them, by the way. It might be as many as 200,000 people fall in that high-risk group. So we really need to get started with them the next week or two and try to get as many of them done as soon as possible. So to that extent, the Johnson & Johnson vaccine really helps us because if we can get those people with 1 shot and then get them a fair good amount of protection there, that really does help us in our state response.
Okay, perfect. And are we seeing a preference as of right now when it comes to Moderna or Pfizer?
I'm not aware of a preference because quite frankly, all of them are selling out. I mean, some people have their own individual preferences, but quite frankly, what most people are doing is signing up for a vaccine, getting the next available appointment, which is what I recommend. Just get the next available appointment and go get your vaccine. I think it makes the most sense for you and for the state.
What are we going to do? We're hearing a lot about how there may very well come a time where we're seeing so much supply and not enough demand, which is of course opposite of what we started with. When that happens, I mean, what does happen when we see that? Do you start opening it up to more, eligible groups? And do you foresee that happening?
I do expect we're going to reach a point where there's a lot more vaccine than there are people who need it, but I'm not exactly sure when that's going to be. It might be a couple months away, but obviously we're going to move through as quickly as possible with our stratification right now. What you'll see is we get more vaccine available, we're going to open up to the underlying conditions, which is a huge group of people, and then other people of various ages. Obviously, we want to vaccinate as many people who want to get a vaccine. Part of why I think we're going to have a lot more vaccine, though, is Novavax, which ended their clinical trial about 2 weeks ago, is going to go in front of the Food and Drug Administration, either the end of March or early April. And I think you're going to see that vaccine come into the marketplace as well. I haven't seen their data yet, but from what I'm hearing through the grapevine, it sounds promising. So you might have 4 vaccines by April, which is something I just think is important to have as context. Could any of us imagined over a year ago when this thing started that we would have 3 safe and effective vaccines? I don't think so. But to have a 4th, that's pretty amazing. And I think it just speaks to the power of science and really how the innovations occurred. And to that extent, the United States should be proud of that. The science has really done a great job of addressing the pandemic really rapidly. And I really think we're ready for an exciting time when it comes to the technology that's going to advance in medicine. Like, one of the things I really think you're going to see out of the pandemic is how medicine's going to advance over the next decade. Because now there's new technology that's been leveraged that actually works. These are things that have been talked about for a decade, but this stuff works as effective. It's a great time to be in medicine. I kind of feel a little bit like Dr. McCoy sometimes now from Star Trek, because we're starting to see a lot of these things actually come to fruition. It's great to see it.
Yeah, and I want to ask you too, because we have the holiday, the St. Patrick's Day holiday coming up. It seems like people are starting to let their guards down a little bit. Of course, we hear you saying even double mask, try and do these things to keep your guard up. What can people do? I mean, is there, people are talking about celebrating like normal per se. What are you suggesting to people? This is the first holiday last year we saw really wiped out. So.
Yeah, it's interesting. We just survived the Super Bowl, and the Super Bowl we did pretty well with. And I really have to compliment Rhode Island because we did survive the Super Bowl pretty well, because that's a holiday too, right? And I'm Irish, at least half Irish, so St. Patrick's Day, I get it. But I'm not going to do St. Patrick's Day gatherings or traditions as well. And I think we need to look at this in the long run. Like, we've been through so much, but we are really at a critical time right now. Every public health measure is heading in the right direction, but it would be a mistake right now to start going towards things that are like large social gatherings and large parties in particular that really put us at risk, because the variant is out there. And what I mean by the variant, that mutated version of the virus, we've seen the United Kingdom version. This makes me a little bit concerned about our future, because I really could see us coming to, saying, look, 3 months from now, we might be talking about the pandemic that was, not the pandemic that is, if we can stay on target with what we're doing. If, on the other hand, we decide that, well, we've been pent up and need some spring fever, this may just spew out more cases here. So I think a St. Patrick's Day party is not a good idea right now. That's coming from me, who's half Irish. Having said that, Memorial Day, that I'm optimistic about. So on Memorial Day, I expect to see Rhode Island at beaches. I expect people out throwing frisbees. I would love to see a little bit of baseball around. But I think Memorial Day, we can look at that being, that's what we're working for, is working towards Memorial Day.
Yeah, absolutely. And I want to move on to testing real quick. We're seeing a little bit of a concern across the country of people stopping with, the regular testing because either they're getting vaccinated or their loved ones getting vaccinated. They feel a little safer. I think here in Rhode Island, we're still doing pretty well. We've always done well with the testing, and I think that those numbers are still showing that. But what do you want to say to people about testing? Should they still be getting tested regularly, even if they are vaccinated?
Yeah, so I think it's really important to keep testing right now. Rhode Island's numbers have still been quite strong with that. One of the things we're doing at our testing sites, if you need incentive to go get tested, one of the things we're doing is we're giving you a free KN95 mask. So it's a high quality mask, gives you a nice seal. I like the KN95 partly because it doesn't fog up my glasses so much, but I know I'm protected when I wear this. I'm not just protecting you, I'm protecting myself. So that makes me feel a lot safer when I go out in town. But I do think it's important to say, look, let's keep the testing going. It's really the best way to protect your household. So to the extent that people can do that, I would encourage them to keep doing it. Portal.ri.gov works pretty easily. Right now, our turnaround time is under 1 day. That's amazing when you think about where it used to be. Our turnaround time for lab is under a day. So really, you're going to get the results either the same day or the next day. You should get an appointment the same day or the next day. So it's convenient, and we're all over the place, by the way, right now. We're all over the state, so we should be near you.
Yeah, I just got my 2K and N95s last weekend, and they're my good go-to backups. So that's great. And then just I want to follow up real quickly also on what we were talking about earlier with listing the type of vaccine, like you said, being transparent about that, letting people know what's going in their body because they deserve to know which vaccine is being injected into them. But do you see the state straying away from that at all in order to prevent people from quote unquote vaccine shopping or doing it a different way? I think I was on the CVS website, and I think they don't show you until the very end which one you're getting. Is that something that you think maybe would, encourage a little better results when it comes to that? Or do you not see that changing much?
We're going to be as transparent as possible, quite frankly. I think people are being tired of told what to do during the pandemic. They want to exercise their own freedom of choice. We want to encourage people to do that. So to the extent that we can let you know what vaccine's available at each site, we're going to do that. I think with the pharmacies, they're giving you what they have. I don't know that they're hiding anything. I think they're just telling you this is what we have. And I think to the extent everybody's working with this difficult situation as best they can. Kind of my main message to folks, though, is if you can get an appointment for a vaccine, they're all good enough for me. I promise you, they're all good enough for you. Go get a dose.
Yeah, perfect. Anything else you want to add that we missed? I just want to go back and make sure none of my other colleagues have questions.
I'll give you one just little extra bonus point here.
Yes, please.
We haven't had any flu deaths so far in Rhode Island this year. Normally this week, I'm talking to you about flu at its peak. So normally this week during the year, we are miserable with everybody having the flu, and we're talking about it. There has been some bright spots during the pandemic, and this is one of them. We're just not seeing a lot of flu. So that's something that people can say, look, there is some victories there to be said.
I just listened actually to your podcast with Dr. Chan on that episode, and it's great because it's like, we know that these things are working that we're doing because that's definitely something we're seeing less of. So it's very good.
Thank you for listening to our podcast.
I love it. I told Dr. Chan, I said, it's great. It's super helpful.
We just finished recording our most recent episode. We record them Tuesdays at noon.
Oh,
so
cool.
we just interviewed Jeff Stahlnecker, who's the pastor of Ocean Point Church in Middletown, Rhode Island.
Oh yeah,
because
yeah.
we really wanted
before, yeah.
Yeah, we wanted to get some perspective how it's affected the faith community, and he was great.
Yeah.
One of the things I love about podcasts is you have time to just talk to people.
Yeah.
He was so honest, and it was just like, oh my gosh, it was awesome to talk about.
Good. That's great. I'm looking forward to that one. Well, hey, thank you so much for your time, and
thank you.
Stay healthy, and I'm sure we'll talk to you again.